Lifting Neighbourhoods Together grew out of about 20 years of experience that we had in community renewal, working in small neighbourhoods of about 5,000 people, where what we began to realise is that in terms of the public system, the solutions to poverty had become more complex than the problem itself. If we look at how the system is organised in terms of those ingredients, what we see is a very, very complicated picture. And if you put yourself in the shoes of a person living in a neighbourhood like that, then there's a whole plethora of organisations trying to help, doing their best and trying to help. But which door do you go in? It's very, very difficult to know, if you're an individual, how to get the right sort of support. And of course, people who are living in circumstances like that, they need support from a range of different agencies. They're not just going to need support from one agency. And unfortunately, even in the best situations where some of these organisations are a bit more joined up, they tend to be joined up in a kind of linear way. And so it's almost like a conveyor belt, where an organisation will do a little bit of work for someone, then their remit runs out and they have to refer them on to another agency. And then they go to that agency, they do a bit of work and their remit runs out, and then they need to go to the next agency. And for an individual, very often that means that people have to tell their story again and again and again. And it can be quite demoralising. And also they have to build new relationships again and again and again with people in these different agencies. And one of the things that we've discovered in recent years is that a lot of the time when someone steps forward to ask for help, the first thing that happens is an assessment process. And the assessment is to find out whether or not that person's eligible for that service. Do they meet the rules? Do they fit with the rules? And sometimes, and sadly quite often, the answer is, sorry, you're not quite the right person for us, or we're not quite the right agency for you. But if you go down the road, there's another agency and they'll be able to help you. And that has a large negative impact on people's confidence. So we thought it's time to try something different. It's time to try and see if, instead of people having to fit in with organisations' narrow set of rules, can we change that around so that the organisations begin to try to see if they can fit around the needs of individuals and families living in an area, and to see whether or not we can do that in a way where people don't need to tell their story all over again, where people can go through one door and it will be the right door, and that they can have a lasting relationship with someone when they go through that door who will support them to identify what they want to do in the future and walk with them as they get support from different agencies in a very integrated and coordinated way. So Lifting Neighbourhoods Together is a test of change. It's about trying to see, can we move from the current silo system where we have organisations with narrow boundaries, narrow sets of rules, to a situation where we have a local integrated team. And that local integrated team will take care of managing the relationships with an individual or a family, so that they have the trust that they build up when they come through the door, that's conveyed into the introduction to the type of support that they need.
I feel the Lifting Neighbourhoods Together is such a great project, because you don't turn people down. That's what you know, what we've been talking about, the silos, working in silos. Yes, you are, you know, because you fulfill this and that criteria, you tick all these boxes, so yes, we can take you on, so you can easily demonstrate our outcomes, which in actual fact life is not, you know, that clear cut, and things change and people have different circumstances at different stages of their lives.
The way that we envisage this neighbourhood team working is that in each of the two areas, we have a core team. So Community Renewal in Edinburgh has a core team. Building Futures East in Newcastle has a core team. But this is a small core team. And the reason why we want to keep it as a small core team is because we want to see whether or not this test of change can be replicated. If it's successful, can it be scaled up? Can it be replicated in other parts of the UK? And so rather than having a larger team, which would require a lot of resource, what we're trying to do is see whether we can get donations of time coming from other agencies who donate their time into joining with their core team. And what we're asking agencies is to donate at least one day a week. But we hope as the project becomes more established, we may have donations of time which are closer to full time. And one of the things that we have said to the organisations that are donating time is that whatever the key performance indicators are which relate to that person's job, we'll help them achieve those key performance indicators, but just within a smaller geographical area. So they'll be achieving them within the area of the Lifting Neighbourhoods Together initiative. And each donor of time brings skills and experience into the team. And we have an idea of, an integrated team having skills including employability, benefits maximisation, engaging young people, engaging older people and supporting older people, skills around community development, place making, skills around education and training. And so we start off with our core team, and then we look to see which skills we have within the core team. And then we try to see if we can recruit people from the agencies who could provide the skills that we're missing. The idea behind the time donation is that they would spend 70% of their time working on their day job, and the other 30% of their time they'll spend working on engaging new people through systematic door-to-door engagement. One of the things that we know is going to be needed is a shared way of working between organisations. And this is one of the key elements of training that we've been providing to our time donors and to other partners. And one of the key elements of the training is something that we call a holistic assessment. And a holistic assessment is when we look at the future with a person, we try to get an impression of what would life be like for them a couple of years down the road if there had been a lot of improvement in their life. And we build up a picture gradually with them of what their current situation's like, what's their typical week, their social opportunities, their family situation. We then look at their health, we look at their self-care, we look at their housing situation, we look at their financial situation and their employment situation. And we work up to this vision of the future of what change would look like. And once we've established, that vision, then what we're able to do is we're able to share that person's vision and that person's goals with each of the different organisations that come in to support them. So the person doesn't have to tell their story all over again. We're able to share with their consent the key information so that the support that they get from those other agencies really becomes quite seamless. And we've been delivering over the last year and a half, several rounds of training to organisations, staff who are interested in becoming time donors and joining the team. And one thing that we can say about the last year or so is that there's been a very, very positive response to learning this new, more holistic, more flexible way of working with people.
It was important really to think about where specifically we wanted to start this first year with time donors. This came about from considering which parts of the system and subsystems this project interacts most with. So from the front door engagement, the themes that were and are emerging were around social care and housing. The main two organisations that were mentioned time after time were Newcastle City Council and Your Homes Newcastle.
Yeah, so we were initially involved in the original training delivered by Paul.mcolgan. The training that we did was the listening conversation and the holistic assessment, which is what we carry out now during our door knocks. Your clients are at the centre of the assessment. There's no targets, there's no strategies that you have to follow, there's no ticky boxes. It's literally having the client take the lead on their programme and their development.
Yeah, well, obviously from the local authority, Newcastle City Council, so we're providing an opportunity to be a time donor for the project, which was exciting, and I think was an opportunity, particularly over the last 18 months of COVID, where we've been, very much working from home, working very differently. It's been an opportunity to kind of link with an organisation that's been, on the ground, has a grassroots grounding within the local community, within Walker. So yeah, it's an opportunity to be part of that of the project as a time donor, which has been really exciting. I think it was being very well supported through my organisation in terms of just allowing us to kind of, be part of a project where we're getting to hear individuals kind of, thoughts, feelings, views, what's happening in the community, what's important to them, what matters to them, and from our perspective, that allows us to kind of go back and have that time to think about, what our services are providing, how might we provide them differently, what are we doing well, and what we can improve on.
It's fantastic actually to learn from them and see them bring their experience and expertise and connections into the work that we do. Both Daryl and Carla have linked the project into their organisations very well indeed. They've shared their intel and all of their information whenever we've needed it, and hopefully we've reciprocated.
So we go door to door within the community, knocking on people's doors, and it shows that we are present within the community, it puts a presence there for them, whereas in other ways of working, you're waiting for the customers to be referred to you. We are picking them up, and it's very much prevention rather than cure.
So far, I'm very, very excited about the new developments, and especially going through the neighbourhood and being able to speak to every single household and engaging with people meaningfully, whether to address their individual needs or needs as their household, or whether they have an appetite to engage in wider community developments. And I think this will be very beneficial in the future for Magdalen, Bingham and Hay areas to start addressing the lack of services and lack of support they've been having over the past 18 months, especially with the pandemic.
But it's it's time to get to understand that person, to kind of get to bring out the nuances of their interests, what's important to them. And I think understandably, as a statutory organisation, we have a duty to respond and to deliver. And sometimes those timescales are very tight, and that's often the case. But I think this project allows just those conversations to be fleshed out in a bit of a deeper sense.
But yes, stick with someone from beginning to end, and I think that's what is so attractive to me in lifting neighbourhoods together, that you don't have prescribed time, you don't need to achieve things within 3 months, 6 months just to present outcomes. You are there with people to support them, and obviously their needs might change and evolve over the time that you work with them, because let's say they are facing some crisis to start with, but then as things progress, as the crisis is being averted, they probably will have more opportunities and more time to reflect on their needs that are maybe not that directly, you know, linked with crisis. They might want to, I don't know, access education or pursue some other activities that they probably would not have the opportunity to think of if they were in this perpetual crisis.
Over the next the coming months, I'm looking forward to continuing to build relationships with the team, with the other time donors. It is invaluable sharing information, understanding and gaining knowledge of services that I don't generally come into contact with on a day-to-day basis within my usual role.
So what about the next 12 months of the project? We're now in conversations again with the organisations who are able to donate time, and we're going through at the moment setting up the governance structures so that can become possible. We also we've been doing several rounds of training and induction, training new time donors in our holistic assessment and our listening conversations. We've started to map out the systems, and over the next 12 months, we'll be doing more relationship building within the subsystems. And we hope to, in the springtime, bring the subsystems together into a conference where we introduce the whole system to each other, both in Edinburgh and in Newcastle. So we hope that the next 12 months we're able to accelerate the project, and hopefully most of the restrictions that we've faced in the last 12 months will no longer be in place.